Thank you all so much for joining us, and we see some familiar folks who have been joining us since last Friday, or maybe you were here on Tuesday. Thank you for joining again. We're really excited to continue the conversation. My name is Allison. I am the community facilitator for the Northeast and Mid-Atlantic region, and we will be discussing some different ideas led by Jane and Sissy, and I'll introduce them in a second, but just to kind of let you know what to expect. These calls have been going approximately 45 minutes, and we will let Sissy and Jane speak for a little bit, and we would love to hear your comments and questions in the chat. So if you just go ahead and click on chat, you can type your comments and questions there. And then when we open it up, if we call on you, we will unmute you to say your comment out loud and participate in this community discussion with us. So without further ado, I'm going to turn it over to Jane, who is the founder of ACES Connection and our publisher.
Thank you, Allison. I appreciate that. And I'm sort of going to be holding my neck here. Not because anything's going on, but I forgot to, and I wore stripes, and that's not, doesn't look, it sort of makes your eyes go nuts. So I'm doing that. Sorry about that. I just wanted to cover a few things before I turn this over, or we start the discussion with Sissy. And someone had emailed me and said, you know, please don't use the words, this is the new normal, because this isn't normal. And I thought about that. And actually, I had a different take on that. I want a new normal. I don't like the normal we had at all. I don't like the way that, our society didn't help people who needed help, that it wasn't giving everybody health benefits, that it wasn't providing access to good education for everybody, that it was making parents work 2 or 3 jobs and never see their kids. You know, that's not, it's kind of akin to the to ACEs, because a lot of people, when they first learn about ACEs, they think, well, you know, I had 5 of those and so did everybody else I know. Isn't this normal? And it may be normal, but it's not healthy. So what we had was not healthy. So I'm going for the new normal. And I think I'm going to actually change the name of our brainstorming sessions to that, because I want that to be the foundation of what we're doing. So I see a few thumbs up, so I'll go with that. The other thing, actually, does anybody have any comments on that? Melissa did, so.
Yeah, let me unmute Melissa here, and actually, let me, I'm going to change the settings so that Melissa, okay, Melissa, go ahead and unmute yourself for this moment. I've made it so that you can do that.
Yeah, so I was just saying that I'm really excited because I feel like this has effectively dismantled our education system for us. And so I'm really ready for us to get folks from historically marginalized communities into the center of rebuilding it. I have been mentioning it in a few places, and I get a handful of like, yes, but not like a lot of like, how are we going to do it? So I'm like really trying to get people to talk to me like, how can we do this? Like, and not just in my community, but like on a very broad scale. I mean, the education system is dismantled for everyone. So like, how can we do this very broadly?
Awesome, thank you so much. Jean, did you want to share your comment and unmute yourself for a second?
Yeah, okay. I just had to make sure I could unmute. Yeah, I'm agreeing with you about the new normal. I think I'm ready for a change also. What I'm finding when I go out, even to the grocery store or even just walking around the neighborhood, people seem friendlier. And I think people are starting to think more out of the box. One of the places I work is a school district, And we are starting to look at what are things that we could be doing differently, or how can we change things. And I do agree with the education system. I'm hoping that this brings on a much needed change with our educational system.
Thank you so much, Jean. And we have another comment from Elizabeth. If you want to unmute yourself, we invite you to comment. Thank you.
Yeah, just something I've been thinking about over the last few days is that, you know, I mean, we have heard so much resistance, you know. We can't do what we need to do to stop, to slow down climate change. We can't do what we need to do to provide a basic income to everybody universal. We can't do what we need to do to fix up the healthcare systems, right? I mean, and this is me from my perspective in Canada and specifically in Nova Scotia as well. But I mean, we've done all those things in days, not weeks, days. And we've been told that we can't do this for, you know, we can't do it, or we can't do it for years. And also then the implementation of, you know, I mean, it doesn't take 17 years to implement research. We've done it in, you know, a number of months, right? So it's like, there's no more excuses.
Thank you so much, Elizabeth. Jane.
So I think what this shows is that we have a great opportunity as, you know, the people who are part of this ACES movement to do some significant work in these next 8 to 12 weeks. So if you have ideas about what we can do to support you, or that we can do as a whole community, let us know. Get the word out that we're really pushing this so that we can get more folks to come to a place where there will be some ideas and some plans, because in every sector, there are people who have integrated practices and policies based on ACES science so far. And so we have the seeds to start this. And this is a time when people are listening and interested in all this. So yeah, just keep giving us ideas on that. And Carrie has added a comment too. You're on mute, Allison.
I'm on mute. Well, Carrie, you're also on mute. Oh, that's all right. We can come back. Carrie is also, many of you know, a staff member here at ACES Connection.
Yes,
And
you can read that. And I think Carrie's still having the problems with her audio as she was before. So, so everybody just read what she wrote there. It definitely needs to be all turned upside down, which is what we need to do. The other thing I just wanted to let you know that tomorrow, Nada York is going to be joining us, and I did a story on her, and I'll put this in the blog post for tomorrow. 3 years ago, I think. She's a pretty amazing person. What she did is she integrated ACES science into batterer interventions course. And what she did was then actually see that you could reduce recidivism from 60%, which is what you do if you don't do anything, which is what most of the batterer interventions courses were ending up at, to anywhere between, depending on the conditions and the place, anywhere from 0 to 25%. So that's pretty remarkable, and she's going to talk about that a bit, but also some ideas about what can be done now for the next few weeks while people are at home. So now I just want to get to what we're going to be addressing today, which is we're really lucky to have Sissy White with us. She is our community facilitator or community manager for Parenting with ACES. And so today she's going to be talking about what's going on with Parenting with ACES, ACES in education and practicing resilience communities in terms of providing more information that's relevant to the COVID-19 pandemic. And then how figuring out what support is right now, because that's a real challenge for a lot of folks. And so we can talk about that. And then how to grapple with anxiety, even though we know with our knowledge about ACEs science that what's happening in our brains and our bodies, but still how difficult it is to regulate. So without further ado, Sissy, if you want to address that first place, what are you all doing in those 3 really relevant and important communities?
Well, I'll just start. I'm so glad we're having this conversation. And for me, like, I just keep saying the conversations are the calming. Like, for me, the conversations, just saying like how it is, including when it's uncomfortable, for me is so calming. And I'm so grateful that we have spaces to share. In terms of what we're doing on the site, I just wanted to remind people, because I know we have so much on our site, that like all our webinars are really housed in the calendar and our events. And then within our communities, the ones that I'm going to be talking about, we're creating a simple way to get resources related to COVID-19, that's related to COVID-19 and how it's impacting educators. So ACEs in Education, I see Lara's here. She's working on that. She's already done a post. She's adding resources, and we're going to have something a little bit more organized and easy to follow. Starting next week, we're working with a graphic designer to make sure it's super simple, because so many of us are overloaded even with resources, and we just want to have something that's simple, quick, easy to find, go to the parts we're interested in. So Lara's going to have that on ACEs in Education. There'll be stuff for teachers as well as for students, teachers and staff and administrators, as well as students. I'm going to be focusing on the same in the Parenting with ACEs community, as well as practicing resilience for self-care and healing. So we really want to make sure everything we're doing, obviously we have a big focus on COVID-19, but in those 3 places, we want to have some very specific how those relate to those topics. So we'll have those next week. In the meantime, where there's been so much posting on ACEs Connection and so much sharing and so much generosity of free stuff. So that's always going to stay in our blog posts on the homepage. It's always going to be something that we're sharing within those what we call interest-based communities, those special topics. So that's all going to be there. It's just going to be a little bit easier to find. And then the other thing I just wanted to say is, please share about those topics, what you're struggling with, what you're experiencing, your stories, as well as any resources that you're coming across, so we can share those out. But we also want to have a place, we are so focused on solutions journalism, but we're also really focused on stories and experiences. So like, how is it for you right now? So Jane, I don't know if this is okay, but one of my friends posted something on Facebook, like a parenting struggle, and I was going to share just kind of like what she was feeling like, and I'm going to post it to Parenting with ACEs, but I just also want to make space for finding out what people are struggling with right now, because this is all still so new. So even though we can apply all that we know about ACEs science, we're doing it in new ways, and that isn't super seamless necessarily. It's like a process. So I did want to make space for sharing just stories and experiences too. So this one thing my friend posted that she gave me permission to post was on Facebook, and she said, "No one is talking about what this means for full-time work-at-home moms, at least not in a real way. It's not a homeschool Pinterest project, that's for sure. It's a nightmare. Everyone's pretending it's not distracting to hear my nephew, he's 2, in the background during my work calls. I'm acting like it's not distracting. I'm acting like it's no big deal. I'm acting like I can be totally successful at all these things. Are you? No one is giving us permission to be actual humans. I don't know who to flag down, but I just want to say, hey, I can't be a home daycare, Google Classroom, hall monitor, lunch woman, custodian, and work a full-time gig. I fully recognize that not everyone has small children, and I just have to say, I'm totally not killing it. How are you doing? Are you working and juggling kids during this insanity? If you are, tell me what you're doing. If you're not, please don't comment. I'm already sick of / jealous of your out in nature posts, your super strict schedules and your updates about what you've cleaned or organized. And she got 40 comments, and it was just, you're not alone, I'm overwhelmed, I need FMLA, or I'm going crazy over here. And this is just one mom. You know, this is just one story, and everybody is experiencing this differently depending on what you already were experiencing before this happened. And I think I was just so appreciative. For me, that gives me space to breathe when somebody's just being honest and real and sharing. And I need that in order to then find like solutions or resources, but to start with solutions and resources before knowing what is the struggle or what people are experiencing, I don't even know how to do that, you know? So I guess I'm just wondering how everybody else is doing and coping, and you know, when we're in so much uncertainty of what's happening.
Yeah, so that's an invitation. We want to hear from you and how you all are doing, because I think that that Sissy was right on when she said figuring out what support is right now is a complete challenge. You know, I think that all of our previous supports are really not relevant, or many of them are. So any feedback or ideas? Carrie?
I just want to know if, and I don't know what is going on with my computer, but I'm on the phone now. If anybody else is experiencing time warp, it is as though time is just devolving. What is it that the pilot in World War II said, that the minutes last for hours and the hours last for days, and then there are and it's all punctuated by these minutes of just absolute sheer terror. But the time warp is really one that is strange to me. So I'm wondering what people are doing about time. Thanks. How to track it. And I think I may go back to tracking it every 30 minutes. Anyway.
Thanks, Carrie. So we have a comment here from Lucy. If you want to go ahead and unmute yourself, Lucy.
I absolutely agree. I swear I woke up this morning and it was Wednesday, and I realized today I need more than a checklist of things to accomplish in a day. I really do need a calendar so that I know what day it is, but really going back to the basics and reestablishing that we have to get up and get dressed and brush our teeth, and all those events still need to happen even though our life is completely different, and then making those choices and reevaluating what is important and taking that on. It's like, okay, we got rid of everything that we were doing in our family, but now what do we want to add back in, and how does that look differently?
Thank you, Lucy. Okay, we have another comment from
Mathy. Hi, everyone. Jane, it's so good to see you. Hi. Oh, Gail, there you are. Hi. So I have this unusual position of being a mom who's changed the interactions to online. Being an adjunct professor, now I'm teaching online, as well as an evaluator. So the first is just a comment as a mom. It's been really crazy, and I hate this online stuff. And I love this in-person interaction, which is one of the reasons I took to teaching, but now I have to do everything online. But it took me a few days, but then I just tried to change my whole entire framework. And now we've started playing charades and taboo online with my folks in India, with my daughter's friends. And so I'm the moderator. It just takes a while. And tomorrow we have a cocktail party online Friday evening. So and the time management is so crucial. It's like I have to pretend I'm at work and then take a break, but I've had to regulate my own timing to my kids whenever they wake up. And so instead of providing lunch every time some person comes downstairs, I've instituted this, like, okay, either you all come downstairs and we have lunch together, or I'll just make the stuff and you get it whenever you have time. So it's been a little difficult, but some structure has to be imposed. And I figured, I mean, each one of us has different things, but more importantly, I have a comment. So now we're Westat, which is where I work. We're advising the regional centers of education, who then try to support the state educational facilities. So interestingly, and Jane, you'd be really excited to know this, trauma was one of their needs. So what I've been doing is putting together how to increase capacity of SEAs, the state educational agencies, on how to infuse trauma-informed practices in schools, so at all levels. And there's a huge literature to it. So we were all preparing for that, and all of a sudden this COVID came up, and now we're scrambling to include the COVID and its related anxieties and the change in family network and everything, and trying to advise what state educational agencies can do and who will then advise their schools. So if any of you have any comment or, just elevating this to like a capacity and an advice at the school level kind of thing, but school is for everyone, like the educators and the families and the parents and everything. So feel free to email me or say, provide a comment here. Thank you.
Thank
And
you.
the person that's right next to you, at least on my gallery, is Laura Kane, and she actually runs ACEs in Education on ACEs Connection. So I think she'd be a perfect person to talk with about
Great.
now.
Laura,
And
will
I've
you
found
drop
a
your
lot
email
of
in there?
resources on ACEs Connection. Like I've looked through, and it's been really incredibly helpful for me.
Great. And the other quick thing before Sissy or Laura want to chime in is that both of you are talking, reminds me of that line in Downton Abbey that Maggie, what's her last name anyway, said, "What is a weekend?" We're going back to that time when we just don't know what a weekend is. It's the whole time thing is very discombobulating. So, Sissy or Laura, did you have something to?
I was just going to say, with schools, one thing I've noticed is that my daughter's school, they're reaching out more to the parents, which I really like, in terms of writing about what are they expecting from students, but also what are they expecting from parents, or what are they not expecting, which is a relief. Like, we're not expecting you to take our places as teachers, to the parents, because a lot of parents are feeling like that I have to homeschool and work full time, and I can't, and also I'm dealing with the losses my kid is having with, not going to the prom or graduation or seeing friends or, anything. So that's really nice, because it's kind of like they're talking to us about what our kids are doing, or what they're expecting from our kids, what they're expecting from us. And that isn't, I love my daughter's school, but that hasn't always been the case. And that has been interesting. And then also they've really connected us in on how you can support your kid. And also for parents, with the parent association, how parents can support other parents who are struggling. Like, how can we share getting the computer and the resources and the homework, because we're in a public charter, so we're in 30 towns. But I really do like that teachers, administrators, and students are getting some bulk same emails, and that's been really nice and helpful, and resetting expectations.
Laura, did you want to add anything?
No, I'm just loving it. Sorry, my house is noisy, of course, because that's been the balance. From ACEs Connection, we work at home all the time. I'm just not used to having everybody else here too. Especially two, teenage boys who, when they talk softly, sound like they're yelling. So I'm always like, shh. But anyway, yeah, no, I'm loving this discussion in so many ways. And I love what Melissa said. I've been thinking about this a lot lately. I'm a huge progressive education advocate, and have been for a long time. So a lot of the stuff that has gone away is stuff that I've wanted to go away for a long time, like universal testing and all of this kind of stuff in the way that it was being done, at least. So I'm super excited for kind of what has been forced upon us to show us some opportunities of what we can do differently. And then around the trauma, I mean, you know, what I do for ACEs Connection and also what I do outside of ACEs Connection is all around trauma-informed schools. And so this has been quite interesting to watch and to see how people, colleagues that I work with, like Eric Rossin and other people who have been contributing really specific supports around how do we respond in a trauma-informed way in this environment, because it's related to what we do, but it's also unique. And so I've Teaching Tolerance did one. There's been some really great posts lately in the last week around really connecting to, you know, the pillars of trauma-informed approaches and how do we create safety and connection, you know, and all of those things in this environment, which has been super helpful. So I'm working right now to try to collect all of these in a way that's not overwhelming, because that's been one of the problems that I've had, and Sissy and I've been talking about this, like even when I go to look at other people's collections of resources, I'm immediately overwhelmed because there's, you know, like a list of, you know, 30 or 40 really great things. And I'm like, okay, I can't even go down that rabbit hole right now. So I'm trying to figure out a way. This week we're working on how do I pull all of these things that are coming out together in a way that's a little bit coherent. So anyway.
Great, thanks. And I just wanted to comment on something that you are put in the, Lucy, why don't you go ahead and say what you wanted to say, and because I have a comment on that relates to what Laura said.
Which comment are you referring to?
The first one, universal crisis, and we have nothing from the schools.
Yeah, well, so I guess what I was thinking is now we can say that this crisis has affected everyone across the population. And even though we know that ACEs does that as well, in general, I think there's this perceived, I don't know, bias, I guess, that it's really focused at a lower income population or minority population. And so that could be part of why these are not systematic practices, is that it's only for like what our junior high club refers to as those kids. So this might be the opportunity to say, well, now, no, it's actually affecting everyone. And we, even as professionals, it's affecting us. So how can we play off of that to really go forward and implementing this at a systematic level?
So what just a quick addendum to that is, maybe if you're in the boat of you haven't had much from the schools, maybe we need to step up and provide some sort of bridging information. So we'll talk about that.
Great.
And just following up with what you're saying, Lucy, and a little bit with what Melissa was saying, I think another thing is, you know, our school was slow to close. And it was in part because 1/3 of the kids get food at school. And so you had to balance the risk of COVID with the fact that there's food insecurity, and that without the buses running, getting to 30 miles away to the food, which is the food wasn't going into the communities, it was going to the school, was going to be a different hardship. So weighing stuff that we haven't always discussed, as this is our whole community, like what all the things we're balancing as a school community. Not everybody knew 1/3 of the kids were getting 2 meals at school. So it was making conversations also in a different way about, this is all of us. We're all interdependent, and the decisions that the school is making, it was more transparent of, here's why, here's what we're thinking about. And people were brainstorming together in ways that people who weren't always even in the conversation. So I do think that there is some hope, the hope for disruption, I guess, and system-wide changes is hopeful, even though there's also a lot of loss of routine and schedules and social connectivity and all the buffers that school is for kids, but also can be for us as parents, knowing our kids are safe at school, knowing our kids are getting socializing at school, knowing our kids are getting exercise, whatever, those things that we do have to now provide at home or worry about or think about differently as we're also working and their schooling, and maybe our resources are less. So lots of potential gains and losses too.
Sissy, I wanted to add, my undergrad work was mainly in food insecurity research in the Bay Area of California. And, you know, what comes up for me is just anger that we even live in a nation that could let children be food insecure and let them not have meals. I just feel so enraged about that. I'm so grateful that we're having this discussion, but it's really disheartening to know that there are families that don't have enough food to eat. And it just seems like, how can we still be facing this problem as a country with so much wealth? And there's just so much work to be done. Carrie, did you want to say something?
Yeah, I just kind of ache for the little kids for whom school was the only safe haven. You know, if you grow up in a home where there is a lot of insanity, for those kids, being dropped off at school was kind of I know for me, it was a freedom. It was like, whoo, you know, this place is scary, but it's less scary than that place was. So the kids who are acting out and are just really so difficult to control, I'm really aching for them and for the parents who are who probably experienced that themselves and so are that much less able to deal with their children's loss of that sense of safety. The food and the place where there's probably not going to be a lot of loud, crazy noises for a while. So, yeah.
Thank you, Carrie. Okay, we have Leah. If you want to unmute yourself and share your comment, we would love to hear from you. There you are. Great.
Yeah, I was just going to say that I think I'm a case manager and I work for a behavioral health agency, and it's frustrating, you know, to see that some families are getting a lot of educational support and some aren't. Like I just talked with the dad in one school district, and he said, no, they didn't give us anything. They weren't prepared at all. You know, and it's just so frustrating the way that our schools receive funding based on, you know, the income and the population in that area. And so it doesn't really help. I mean, someone else said that the crisis is affecting everyone, but not everyone has access to the same support. So I think that's frustrating.
Yeah, thank you. And then we had a response from Melissa.
Yeah, so I just completely agree with that. And that's what actually, when I talked to my director a few minutes ago, we were talking about is that our preschool is part of a district that the K-12 families are getting, they've pretty much been able to launch, I think, close to one-to-one technology now so that every child has a device. And then one of our preschool families was at a lunch site and asked for an application to apply to get a laptop or a tablet. And they said that she wasn't eligible because she's from the early learning center, and like that was the only thing she wanted and like the only resource she really was in need of, and we couldn't even provide that for her. And so that's challenging. But then neighboring districts in more wealthier areas around here have been able to just get everything going off the ground. They've got their online stuff happening. Every child has you know, all these things to be able to access. And so it's just the inequity is very significant and very apparent when, you know, families from nearby areas, you know, are able to see that and recognize that.
Leah, is it possible that that for people there to get free hotspots? Because I know those are being offered now by a lot of internet carriers. I mean, cell phone companies.
Yeah, I also found out that Comcast in our area is offering free internet service for 60 days for a lot of people. But I don't think it's just the internet access that's the problem. I think it's also that, some wealthier districts already sort of have that virtual schooling in place, whereas some don't even have that platform available. So I think that's an issue too.
Okay, thank you.
Gail?
Sure. I was just talking about, this is just just an anxiety that, because we don't know how long this is going to be lasting. And I have a freshman college student home, was very unhappy to have to come home, but recognized she had to. And she's okay, thinking that it's going to be ending relatively soon, because that's what the president had said, and that's what, a couple weeks ago we thought it would just be a few weeks. So it's just and I think we're all, I'm just going to speak for myself, I feel anxious because, like, if you look at the news, I don't know, is this going to be a few weeks? Is this going to be a few months? Is this our new normal? Like, what really it is it? So I think recognizing that the uncertainty is not a good place for me, and taking care of me when I get into that, and then trying to model that for my daughter and help her, all we know is right now, and it is on, and we're in lockdown right now. So what can she do to help? Yeah.
Maybe that's a good segue into the last question, is how do we deal with our anxiety, even though we're supposed to be the ones who know how to deal with it in this ACES Connection community. And, I've been there just like freaking out at 3 o'clock in the morning, and then having to say, okay, start doing your, turn on the meditation tape, whatever you have to do to get calm. But whoo, yeah. So anyway, Sissy had a good approach on this, addressing this.
Well, I was just going to say, there was one thing I was thinking a lot about this, because I was talking to somebody yesterday and she was saying how triggering it is to be home, because home wasn't a safe space. So shelter at home is like, she feels trapped. It's very triggering. It's not a good feeling. And she has to remind herself, like, I'm an adult now, like my home is safe. And I think, and somebody else was saying, having experienced domestic violence, like I feel so isolated. This reminds me of that. But I think there's the triggers and the reminders, but then there's also, like, what if that's now? And what if there's a safety issue now? So I guess I feel like there's survival mode and survival brain. And so sometimes we get kicked into survival brain, but we can kind of talk ourselves through it. But then there's also, like, we need to get our basic needs met. So if we're losing our ability to meet some of our basic needs, it is appropriate to be anxious or, nervous or upset or totally focused on security. So I think that discrepancy and, like, kind of where we're starting really matters too, because what we're going to need is going to be different. Oh, it looks like, I think Lori raised her hand. Did you see that, Allison? At least on my computer.
Do you want me to? I wanted to let you finish. And then we can.
Sorry, go ahead. No, I just was going to say, with that conversation, I feel like what I need adjusting to working from home as somebody with, like, immunocompromised, but everybody's here with me. And then I know someone else that has 3 little kids at home, no partner, and has COVID now. So she's like she's facing something different. And, like, but there's like a million examples of the different things. So there's some universal things we can do to get safer and regulated, but then there's also, we have to be safe too, and that is different for everybody. So I just think the conversation is so wide, even though we know so much from the science.
Yeah, thanks, Sissy. So Lori, if you want to unmute yourself and say your comment, we would love to hear. Everyone, Lori is a staff writer, reporter for ACES Connection.
I just was listening to what you were saying, Sissy, and the point about domestic violence, which of course is a great concern about increases. I was just writing up a webinar, a summary of a webinar that occurred yesterday by ACES Aware, which is the initiative in California for healthcare providers in dealing with stress and their own stress and their patient stress and shifting to video and virtual calls. And Dr. Alicia Lieberman, who's a trauma child psychologist at UCSF, she answered a question about how do we deal with domestic violence, considering what's going on. And she said, you know, you need to know the specificity of it, of course, but she's had experience where the fact that people brought it up on a Zoom call was a port of entry. And she said, and this is kind of daring, but what they've done sometimes is see if the partner is willing to talk and to share with them about how it's normal to have all these anxious feelings and feel overwhelmed. And in some cases have been able to move from an individual therapy to family therapy to help protect the entire family and the children. So I thought that was interesting. I wanted to mention that. And I think that that's something that a lot of providers are obviously going to have to be thinking about, how to kind of shift and provide resources to their patients who are at risk.
Thank you, Lori. Cheryl, if you want to go ahead and unmute yourself, we would love to hear from you. It's up to you, though. Great.
With my comment about regulation?
Yeah.
Sure. I think that just the reason these sort of video chats work so well too is it is validating, because there was a lot of stress and our stress is going to change throughout the day.
Yeah, absolutely. Yeah, I mean, I was just thinking how wonderful it is to even be having the discussion and to live in a world where we get to be talking about regulating emotions and experiencing emotions, because that's not how I was raised. This is a very new conversation for me, and I'm 35, you know, so I grew up in the 80s and 90s, and emotions were not part of my childhood. I didn't even know they really existed until a few years ago, to be honest. So, you know, things have been really shifting, and that's really wonderful. I wonder if maybe we want to just take a moment and just feel grateful that things are shifting and we're talking about this and it's helping. Laura, did you want to share your comment?
Oh, I was just adding to the discussion about online. You know, it's going to be really difficult because every state and every community has been handling this differently. So there's no universal approach. And so, you know, all fifth graders across the country, whereas before we're getting some kind of at least universal, closer to a universal approach to learning, with some districts like Philadelphia saying, we're not going to do any online learning, school's off because we can't do it equitably. And they're not letting schools can engage with kids, but they can't grade anything and they can't require anything and they can't require attendance. Other places like where I am, my kids are in school full time online, you know, we are homeschooling them full time. Everything's graded, everything's going to count, you know, and that's for the whole district. So it's really interesting to watch how this is happening. And the conversation around Philadelphia was, you know, are they contributing to increasing equity, because then no one gets online instruction, or are they exacerbating the achievement gap because then now with no direction, the kids that have support at home will continue to get support, or, you know, learning from home, and kids who don't have access won't get any, and that gap will widen further. So it's been a really interesting, and people don't have an answer for that. And there's been zero direction from our state or from our federal Department of Education. So, you know, they're just having to kind of figure this out on their own. So, and yeah, it's just fascinating to me to be, you know, I'm really curious to see at the end of this, over the next year or two, what we show from as a result of these varying practices.
I hope you blog about all of them. I want to know what every state and location is doing and how they're doing it differently. The Philadelphia one's fascinating. So hopefully I'll get to read what you find out on our website. Sissy.
Yeah, and a lot of the schools, like even at my daughter's school, like sometimes it's up to the kids. Like some things are universal at the school, and some things, like if you take your AP exam, it's up to you. You can take it, you don't have to take it. If it counts, if it doesn't, that what's covered in it is only what they learned in school, but not what they've learned since. So you can, like, it's some of the kids are having to make some of those decisions on their own, with the guidance counselor, maybe with the families, if we know. My daughter just happened to tell me that. I didn't know that. But I also wanted to go back for parents too. I think, like, the comment about co-regulating as a family, I think, at least in our house, like, we're figuring out what that means. Everybody's ways of regulating, like, my daughter, maybe it was dance and she can't go to dance, or it might have been, you know, biking on the way home for my guy and he's not going to work. Like, everybody's kind of schedules, or whatever things we found out that work for us for regulating, are maybe have to change and look different. So I am grateful. I've seen the number of posts on ACES Connection just skyrocket, and it's really great to see, okay, what are some new things? Like, not all my old tools work, and I'm pulling them all out. So I'm also trying new things, and I'm grateful that there's so many videos and YouTube things and people saying what to do and things you can do with your kids, which I probably just would have done by myself before, but now my daughter's home. So, like, what can we do together, or what can we do as a family? But it's a learning curve. Like, it's new. And some of it's really sweet and some of it's really challenging and stressful. Again, just, I'm glad we're sharing our experiences, like what is hard as well as what's working. And I hope people post on the site those, because I think those are really helpful too, for validation, as somebody said, and also just ideas.
Yeah, absolutely. And I wanted to say, because Jessica has left a comment here about a resource, 4-H resources. What would be the best place for a post like this on our website? Maybe Lara and Sissy, you could speak to the whole group about, if you have a resource such as this 4-H resource, where should people go on our website? Where should they post that?
I think, ideally next week we'll have an easily accessible, updatable bank of resources. I mean, right now, when I come across really great ones, like I did, I think yesterday or the day before, from Teaching Tolerance, I just post them as a blog, or I repost somebody's blog. People have been posting them individually. And sometimes that's great because it gives it a little bit more highlight. It doesn't get lost in the weeds if if one is standing alone. So you could write a very short blog. It could be, 2 paragraphs with a link, and we can share it all over. But we're trying to develop something a little more systematic and easy to use. That's what we've been working on. So I don't know.
I'm kind of thinking if maybe we want to put some sort of different contact widget on our homepage that's just like, if you have a resource, send it here. And that way we can maybe compile them a little easier. I don't know if that would help, but it's just one idea. So if you have other ideas.
It's coming.
Oh, a resource widget on the homepage?
Yeah, that kind of just points you, especially related to COVID-19, that points you to, like, the CDC, the World Health Organization, but then also ACES in education, or just specific topics. If you're just wanting to hone in on kind of one interest area at a time, it will help. So I would say also just keep posting on the main site, or the home site. If you post, I mean, or the interest-based groups, because if you put it on the interest-based groups,
that's what I was thinking.
We could share it on the home site, or vice versa. If it's on the home site, we can share it in the interest-based communities. Yeah.
And one idea, as you're talking, Allison, what we could do into that post, we call it a widget, is to put, if you have a resource, please share, and then we could be collecting them.
That's what I'm thinking. We may want to, we may want to direct people so that we can collect them.
And we'll also extract the resources from these conversations and put them in whatever bucket is appropriate.
One second. I just wanted to make sure though that, because people are joining this call from all over. If Laura and Sissy, if you could please post links in the chat to the communities that you manage where this conversation can continue. And so they each manage communities that are relevant for our conversation today in education and parenting. And so I just want you all to know that you are welcome to join that community. And what you need is to be logged into our website. So if you go to our website and you're having trouble, how do I join a community? Make sure you're logged in. And then you just will go to the link provided and click the join button. And then you can, we invite all members to make posts. A lot of you post regularly, but some of you don't. And I just want to remind you that you are invited to make a post on our website. So you can either do that from the homepage or within these communities. And if you need any help with that, you can contact your community facilitator. We're all listed on the homepage, and we will be happy to assist you and troubleshoot that. Okay, we had a comment from Jean.
Yes, hi. I've been thinking about the comment someone made about the 4-year-old or the preschooler looking for resources for that. Yes, from the school standpoint, they will look at if they haven't entered school, insurance-wise and everything, that they aren't covering that age group. But at the Foundation for Enhancing Communities, the tfec.org, we have the tip sheets. So what we have done is we've tried to make tip sheets with activities that parents can do at home that does not require them to have special resources. It's with things they should have every day in their home. So again, I'm thinking about the meal play, the kids who are going for the meals and stuff like that. Maybe if someone could run some of those off, and then when parents do ask for that for the younger kids, there might be some activities in there. We've done social and emotional. There's activities we've done from infants and toddlers from birth through 5 years old. So feel free, you can use that website, download anything, whatever, share the resources, whatever.
Awesome.
Thinking that was something that maybe they could do at the meal places.
Thank you so much. I think we want to wind down here, and so I'm gonna, Jane, do you want to guide us to close anything you were wanting to get to, and then I just want to invite everyone to go ahead and grab any of these links you may need from the chat within the next couple of minutes. And thank you all for introducing yourself in the chat. I'm just loving that. I'm just seeing you all interact, and it's just wonderful. Thank you.
Yeah, thank you, Allison, for doing all this. And Melissa, the link to the tip sheets is, if you scroll up, you can find it. But we'll also make all this available in the, we'll pull these out and put them in the blog post as well. This has just been fabulous. Thank you so much for your participation and for all your comments and questions and resources. This is great. And we'll be doing this again tomorrow. Thank you, Sissy, for participating and putting this together so quickly. We really appreciate that. Allison, you're an incredible moderator. So thank you, everybody, for tuning in.
Thanks, Jane. I just wanted to welcome you all to join us again tomorrow. Same Zoom link, same time. Same Zoom link, same time. So West Coast is noon, East Coast is 3 p.m. And we will see you again tomorrow. Thank you so much. And I hope you have a great rest of your Thursday.
Same bat time, same bat channel.